Hello, sorry I'm not there in person. This is a very short discussion about tables, figures, and supplements in the manuscript you're planning to submit to the journal. Just earlier this week, we had a discussion in our department about data visualization, and this was the first slide I showed my residents. None of them recognized what it was or who had made this beautiful chart. But I think many of you would recognize this because this was made by a brilliant statistician, I would say, who really doesn't get credit for her statistics work or for her data visualization work. These graphs are better than many graphs that we can make today. And these were made by Florence Nightingale when she was trying to convince the British authorities to improve the conditions in the barracks. Basically, what it shows is the cause of mortality or the causes of mortality among soldiers in the Crimean War. So, if you look at each slice, the blue indicates deaths due to mitigable conditions, probably infections and all that. And only the rest, the small part towards the center, are deaths due to actual war injuries and all that. So most soldiers were not dying because of injuries in the war. They were dying of poor hygienic conditions and infections and such things. So she really saved lives by improving their conditions in the barracks. So we'll start with tables. Tables in general should be self-explanatory. That's the number one thing about tables. Imagine that you are looking at a table and you don't have access to the rest of your manuscript. You should still be able to understand whatever is on the table, in the table. And uh, that means there should be a descriptive title. The title should explain what exactly is going to be in your table. There should be a header, which means all the column headers. In this case, you can see neonatal details and value written as headers. There should be footnotes, and the footnotes include expansion of abbreviations, any other description of whatever is needs to be explained in the table. And the table always comes after we mention it in the text. So if I say in my manuscript that the baseline characteristics of the participants are shown in table 1, it should appear in the manuscript only after that. Anyway, when you are submitting to many journals, you will be putting the tables as separately in another document. So they will take care of it. In general, avoid duplicating material in the text and in the table. So if you have already described content in a in the text, then you don't need a table for that. And that works for very short amounts of data, very small amounts of data or short descriptions. But if you have a lot of material to cover, you will still need a table. So one thing you will notice about tables in good journals is that there are often only three horizontal lines and they look pretty clean. So there is one horizontal line under the title and before the header. There is a second horizontal line under the header and one more at the end, just before the footnotes. So these three are the minimum necessary lines and probably the only lines that are required. So keep it clean. The footnotes sometimes have to be very detailed, and you may have to explain a lot of things in the footnotes. So sometimes we add symbols inside the table and use those symbols to indicate the footnotes below that. And there are different kinds of symbols that are used. We won't go into the details of that, but try to use something simple. So these are the symbols we are talking about. When I said symbols, we were talking about this uh, special characters like this dagger sign here, and the dagger is explained in the footnote. But you don't have to always use special symbols. Here, this is a published table, and we had used A, B, C, D, and the journal was quite happy with it. They didn't ask for special symbols. So it depends really on the journal. So like you can see A here, and we have expanded what A means in the footnote. These are some of the symbols commonly used for footnotes. The asterisk you are all familiar with, and you probably have seen the dagger and the double dagger also. The paragraph symbol is another one, and the paragraph mark is another one. There is also a hash or a pound sign, also called the number sign. Now we'll come to charts and graphs. So that was about tables. And when it comes to charts and graphs, the first question I would ask myself when putting one in is if a chart is really required or a graph is really required. So, for example, most pie charts are useless in the sense that they convey very little information that can usually be mentioned as a text or a small table. But they're not completely useless. And if you only have a few categories and you think it improves the clarity of the message, you can still use them. But you really need to ask yourself, is this chart really required? Once you have used a chart or decided to use a chart, you can still make it better by optimizing it. This is a chart from the MRD statistics bulletin that is sent out to JIPMER faculty every month by MRD, and it's showing inpatient deaths by department. So you can see general medicine has a lot of deaths, nephrology had no deaths. This was, I think, November 2023. How can we make this chart better? So one of the problems you notice is that the labels, the department names are sometimes quite long. So it is tilted. And I was finding it hard to read because I had to tilt my head like an owl and read it. So how can we use a similar kind of graph but make it easier to read and maybe make it look a little better? One option is to make the bars horizontal. So what we saw earlier was a vertical bar chart. This is also a bar chart, but the bars are horizontal in this case. And you can see that there is plenty of space now to add the department names, and they are straight, and so they are much easier to read, and the same information is being conveyed. You can also probably see that the lines, the grid lines are missing. That's because we have added the actual numbers, 85 deaths in general medicine, 54 in general surgery, and so on. And we don't really need the grid lines anymore. You can still keep the grid line and the axis if you think the message is clearer that way, and especially if it is for a formal publication. You may not have so much space and you may need to compress it. And these are just two versions of the same graph using different colors that to some extent is a question of taste. But you can see that the message is still very clear that some departments have a lot of deaths, some don't. And the order is also very clear. This is in descending order. This is another kind of figure that you will be probably using in your manuscript. It's always a good idea to have a flow diagram so that the person reading the manuscript can easily figure out how you did the study, how participants flowed through your study, who were excluded, who were included, how many were actually followed up and analyzed. This particular diagram is a concert flow diagram. This is available for download. If you do an RCT, you will want to use a concert flow diagram. But even for other study designs, you have flow diagrams available very often with the guidelines, and you can download and use them. So I would strongly recommend adding a study flow diagram irrespective of your study design. If it's an RCT, of course, it's mandatory. But even if it's an observational study like a cohort study, or let's say it's a diagnostic study, in those cases also you can use a flow diagram to make it clearer how you went about doing the study. So that's a quick summary of what we want from charts and graphs. First, ensure that it's actually useful. Second, optimize it to fit in the given space to make the message clearer to the reader. And if I had to mention one other point, it would be the most obvious one, that you have to use the appropriate graph. And we'll quickly go over maybe some of these examples to uh, just to review what you already know. So for continuous variables, we often use histograms. They are less informative, so we don't usually send it for publication. We just look at them to understand the shape of the data or to choose appropriate statistical tests. Box plots are very common in publications because they convey more information for continuous variables. For time trends, we use line graphs. For categorical variables, we use pie charts, and if there are only a few categories, we use bar charts. And if we have many categories, maybe we can use the horizontal bar charts like I showed you earlier. And others, when we have two continuous variables, we often use scatter plots to show the relationship between the two continuous variables. So this is what a histogram looks like, and you know it, but like I said, it conveys very little information other than about the shape of the distribution. So we don't usually use it in publications. On the other hand, a box plot conveys much more information. It tells you what the median is, that line in the center of the box, and the edges of the box tell you about the 25th centile and the 75th centile, and so the interquartile range. You can see outliers, you can see approximately the range of the data, the spread of the data, and you can also kind of make out if the data are skewed or symmetrically distributed and all that. So box plots convey so much more information that we don't use histograms. And as you can see here, you can even compare categories by putting box plots side by side. For trends over time, we usually use line graphs. So these are very helpful, and they can be for one category or multiple categories, and you can compare them visually using line graphs. And I think we already mentioned bar and column charts. So these vertical bars look very nice and are very commonly used. And you can add labels and titles and all that. But one problem with them is that they are okay only if you have very few categories, maybe 3, 4, 5 categories. But beyond that, it starts to look very crowded. And in that case, we may have to go for the other chart type, which is the horizontal bar. And we saw that already, so we are not going to go over it. As you can see here, we have many categories, 10, 15 categories, but it's still quite readable and conveys the information very well. And of course, we have scatter plots where you can plot the relationship between two continuous variables. These are also fairly common in publications. But I guess a statistician will help you if needed with these things. The most important thing is that the message should be clear to the reader. So I'll use this graph as an example to demonstrate what I meant by clarifying the message. So by default, if I'm plotting neonatal mortality rate in my unit from 2014 to 2018, this is what I get in PowerPoint. So there is this line graph, which does actually nicely show the drop in neonatal mortality. But it's not still very clear to me. I have to look at the y-axis to understand, for example, if I want to know what the neonatal mortality rate is in 2016, it's not immediately clear to me. When I look at the y-axis, it looks like it's just about 25 maybe. The title is on top. On the right side, we have a legend, and we have a y-axis label, we have an x-axis label. But really, when I think about it, do I need to say year in the y-axis? When people see 2014, 2015, 2016, 2017, they understand that these are years. That's more or less common sense. And the y-axis label, neonatal mortality rate or NMR, that also may not be needed because that is what is mentioned in my title right on top, that this is the neonatal mortality rate we are talking about. And for the same reason, the legend also is not required. So I can remove those things. I can make the title bigger. I can put the actual numbers on the graph so that it's easy for people to figure out without looking at the y-axis. And maybe make the background things, including the lines and the axis, a little dimmer, maybe a lighter shade of gray, so that my message stands out. What am I trying to tell them? What I'm trying to tell them is that the neonatal mortality rate decreased significantly over 4 or 5 years. And that message gets across very clearly in this graph, I think. Of course, this is we are talking about sending to a publication, so that's a formal kind of graph. So removing too many things will be problematic. You will still need to put in axis, for example, and axis labels. So like I said, we already have the numbers on. So if I were to use it for a presentation, I might even remove the y-axis because it's the numbers are already clear from the graph itself. Actually, if it's for a presentation, I might make it even simpler and bolder so that it looks good on the screen. But there are also important things to note about making a graph, some bad practices that should tell you how not to make a graph. One of the really terrible things you can do in a graph is use pseudo 3D, and you see this all the time because it distorts the real height difference between the two rectangles. So instead, I would use the regular bars without any 3D effect, and the message is much clearer, I think. And the same with pie charts also, almost never use 3D pie charts. So the summary of charts is keep it simple. Use only if necessary, if the information is better conveyed using them. Use the correct chart type. Don't use pseudo 3D. Remove all unnecessary elements to make your message clearer. I'm not going to talk much about clinical photographs because I am not really an expert in that. But I do photograph some non-human subjects. So maybe I can share a few tips about taking better images if you are planning to send clinical photographs for publication. So we had to take some photographs for our COVID effort, for example, about masking techniques and all that. So I had prepared a small document for my residents, and these slides are taken from that. So there are many things you can do to improve the quality of your images. One is ensuring adequate light and a soft light, positioning the subject correctly, making sure that your camera is stable, the background is clean, and get consent most importantly. The camera itself does not matter much. If a mobile phone is being used, most mobile phones these days can take good photographs. One point about lighting that you can take care of is that bright diffuse light is good for most clinical photography. If you have a sharp pointed light, what happens is that you get dark shadows under the neck, under the eyes, and so on. So most medical photographs we take are of human subjects. It's better to use either natural light, like near a window, or a bright diffuse light, like maybe a brightly lit room with tube lights and all that. Remove obstructions between the light and the subject, and sometimes that's yourself. Uh, you may be standing in the way of the light, so make sure you get out of the way of the light and let the light fall on the subject. In general, we are not taking art photographs when we are shooting for medical purposes, and the whole area needs to be in focus. So try not to shoot at an angle. The front of the lens should be parallel to the area you are photographing. In this baby had a skin condition which we were photographing with consent. At the very least, you can remove distractions from your images and crop it to make the uh, point clearer. You can use simple things like surgical drapes or white sheets to do that. This image was what happened when I asked a resident to photograph a mannequin, where we were demonstrating how CPAP has to be applied to a neonate's nose. And the idea was to show the curvature of the interface uh, seen there. But when this person took the photograph, the main thing that people noticed in the photograph was the other senior resident's abdomen. So it's the same mannequin photographed on the right side, but we just made sure that the phone was at a lower level, pointing towards the interface to show the curvature, and used, I think, a black laptop as a background to avoid distractions. So just something simple to make your message clearer. And the one other thing we wanted to talk about today were supplements. So supplements are simple but important parts of your submission to the journal. So what do you submit as supplements usually? So that depends on the journal and what they will accept in the main manuscript and what they won't. Generally speaking, people often submit things like raw data, detailed methods about some procedures they did in the study, and for nursing projects, often I see long, detailed questionnaires, survey forms, and all that. So these things usually won't fit in your main manuscript. Maybe only parts of it will fit in the main manuscript. So these can usually be uploaded as supplementary files if the journal allows it. And often the journal will ask you to upload additional figures, graphs, tables. They might allow 3 or 4 tables in the main article and tell you to upload all the rest as supplementary files. And if you think they are really important and the reader should have access to them, you can upload them as supplementary files. And some journals will put them up online so that people can look at it, and the original article alone may be printed, or some journals are not even printed nowadays. And other files like audio video files, sometimes they will allow you, but we upload these less commonly, sometimes animations also. And sometimes we have detailed appendices with additional explanations for your findings or if some stuff in your tables and all that. So those also can be uploaded as supplements. That is about all that I had to talk to you about today. Thank you.